Well, more now on the news that junior doctors in England will stage their second strike tomorrow. Last-minute talks have failed to produce agreement over how doctors should be paid as the government tries to improve weekend hospital care. With me now is Mohsin Khan, a fourth-year junior doctor in northwest London, who I believe will be striking tomorrow. Good evening.
Thank you. Good morning.
You were hopeful that those last-minute talks might produce something or not?
I was very hopeful that we could come to some sort of solution that would mean that the proposals for the future would mean that my patients would not be held at risk by the government's proposals. I'm very disappointed. I'm very disappointed that we haven't been able to find a solution. It's not an easy decision for me to go on strike tomorrow, but I can't see any other way in which I can make sure that in the future, if my family were to go into hospital, they would be safe. Because under the government's proposals at the moment, anyone going into hospital in a few years would walk in and see that there are fewer doctors there, not more. They would see that those doctors who are there are tired, overworked, and that's going to be dangerous for my patients in the future.
You talk about the fact that, in your estimation, patients will be at risk under the government's proposals, but no government is going to put forward a health plan that actively sets out to endanger the well-being of the population, surely.
No, I mean, I recognise that the government, as I do, and as many doctors do, want to have better services 7 days a week. We've already got junior doctors working 7 days a week.
So you say neither side is arguing on that. You both want the same thing ultimately.
Yes,
it's how you
we
get
want
there.
we want a better 7-day service. But in order to get there, we will need more funds. We need more staff in the sense of nurses, radiographers, porters, everything else that makes a hospital work. And so what we'd like to see is the health secretary to work with us, work with the other parties, work with everyone, and come up to a solution so we get better 7-day services. What the health secretary is proposing will just leave an NHS that is understaffed, that is dangerous, because doctors will be tired, overworked.
You want Jeremy Hunt to engage, you say. He, if he were sitting here now, would of course say, well, if the British Medical Association had done as you would like Jeremy Hunt to do, we might not be sitting here now. So we're back in that rather frustrating situation from the patient's point of view, that one side accuses the other of not playing the game.
What's interesting is we heard today that the government had rejected proposals which NHS employers and the Doctors' Union had agreed.
This was towards the end of January, we're told.
This is what we've heard today, yes, that essentially you'd have more doctors on weekends under that proposal, you'd have less pay paid, it would be safe for doctors, but the government has chosen to reject this, and we have to ask, why is the government pressing ahead with this in a way that will be unsafe for patients?
The strike will happen tomorrow, clearly. What about after that? Are you prepared to take further strike action?
Going on strike is a very difficult decision for me. I mean, I know that at the end of the day, I would love to be with my patients tomorrow. I want to be there for them. Having to go on strike is tricky, and ultimately it's because I need my patients to be safe in the future. And I can't see this happening at the moment. My hope and my plea to the government is, please step down from this. Please come back, talk to junior doctors, talk to experts, talk to other parties. Let's find a solution to this. Let's not rush into something which in the long term will harm patients.
Okay, we must leave it there. Mohsin Khan, thank you very much.
Thank you very much.